There is no shortage of cyber criminals hard at work today attacking hospitals and health systems with ransomware, malware, and other weapons to extort payment by shutting down vital systems and putting patient care and safety at risk. Unfortunately, there is a shortage of cyber defense warriors in healthcare with the skills and training to fend off such attacks. As the number of cyber incidents climbs each year, it's clear we urgently need to build a cyber-ready healthcare workforce. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly with AHA Communications. While we've seen some growth of interest in cybersecurity as a discipline, demand still outpaces supply of people who are equipped to defend hospital and healthcare internal systems against cyber attacks. The shortage is especially acute for rural care providers. Today's podcast invites three experts to share their insights on reskilling and other methods that can help develop and sustain a healthcare workforce that is ready for today's challenges.
I'm Bill Klaproth. With me is Laura Kriofsky, Microsoft Cybersecurity Program for Rural Hospital Strategy Lead. We also have Josh Heisman, National Managing Director, Security Technical Sales. And of course, we have John Rigi, National Advisor for Cyber and Risk for the American Hospital Association. Laura, Josh, and John are joining us today to discuss building a cyber-ready healthcare workforce. Laura, Josh, and John, thanks for being here.
Thanks, Bill. Great to see you again and great to be here.
Thank you, John.
Yeah, this is a pleasure. Thanks, Bill.
Thanks, Laura. Yeah.
I appreciate you having us, definitely.
Thank you, Josh. So this is really an important topic, and of course, we're hearing more and more about cyber risk all the time. And John, I've read many articles highlighting the cybersecurity talent gap, especially in healthcare. So how bad is it, and how do we get here?
Well, thanks for that, Bill. It is very significant, that gap. And there's a number of reasons for that. One, cybersecurity had not really been emphasized as part of the STEM curriculum over the years. And quite frankly, as society and as industries have made greater use of network and internet-connected technology, quite frankly, has provided more opportunities for the bad guys, foreign-based hackers, to try to penetrate our organizations and steal sensitive data and, of course, conduct these debilitating ransomware attacks. So part of this huge demand, this gap, is based on all these increased attacks that we're facing right now. So we're trying to catch up. And the bad guys are outpacing us at the moment, unfortunately.
Unfortunately is right. And Josh?
Yeah, and I think it's also important to note, even the largest organizations out there, the most mature, struggle to recruit and retain cyber talent today. So we're seeing it at all sizes of organizations, but particularly the smaller ones.
So it sounds like we need to catch up here. We need to build more awareness for cybersecurity professionals. Would that be fair to say, John?
Absolutely. And I think as these attacks increase, the only silver lining is that it is drawing more attention to cybersecurity, and not only in terms of the threat, but as a discipline, what we can all do. And we're receiving a lot of interest, even from clinicians now, who are interested in understanding how they can contribute to cybersecurity.
Absolutely. And Laura, while cybersecurity risk is pervasive in healthcare, studies have shown rural hospitals are often further at risk. So how can a focus on cybersecurity skilling and talent development help lower that heightened risk profile unique to rural providers?
Yeah, Bill, you are spot on. They are, I think, in many ways at higher risk, right? Oftentimes, it's just hard to get that level of talent that we need in those communities and keep it. I think that's a big part of it. Oftentimes, those rural hospitals are dealing with older legacy systems, right, that they struggle more to keep up with. And quite often, the IT staff in those rural hospitals are lean and mean, and those individuals are wearing a lot of hats. And it's really hard when you're a jack of all trades to really develop and hone those cybersecurity skills.
And I would think with the budget pressures that are on rural hospitals, that's got to play into it as well.
It does, absolutely. Although obviously, like everywhere in healthcare, there is a growing understanding and appreciation of the need to invest in this area.
Yeah, John, your thoughts?
Yeah, Bill, and as Laura said, there's definitely a resource gap out in those rural hospitals especially. And it's not only just human and the technical resources, as Laura mentioned, financial. Some of these hospitals strive just to break even. And if they're making a margin, it's razor thin, maybe 1% margin just to keep the operations going. And as I always point out to folks, I say, well, that question, why don't hospitals invest more in cybersecurity? Divert some of all that funding that comes from the government, Medicaid. And I point out, hospitals are not cybersecurity companies. Job one is to take care of patients and save lives. And we know that if we invested every single dollar that we make providing care for patients, in cybersecurity, we still not would be 100% safe from cyber attacks.
So let me ask all three of you this. Josh, let me start with you. What are some initiatives then that you've heard of that are helping close this talent gap?
Yeah, and I think it's important to look outside of just the healthcare vertical, right? I mean, even in public education, for example, you see the same types of shortages in school districts, for example, in rural communities. But I think it's important to work with public education, community colleges, right, for skilling the kind of next generation, but also look at initiatives to retool and reskill existing staff, right, to support those career pivots. Even looking at your clinicians in some cases who are interested in pivoting into those cybersecurity roles. They bring an invaluable perspective to those roles too. So I think that's important as well. But there's a lot of high-tech programs out there I mentioned in public education that historically have focused on engineering roles, I think computer science, that are starting to retool into cybersecurity. So these organizations can partner with those educational institutions and help guide that curriculum to make it successful and again, kind of build that next generation.
Absolutely. Laura?
Yeah, I think there's a number of ways we can do better and that we need to do better. At Microsoft, there's a program called TechSpark, and it really works across rural communities to nurture and find funding for training programs for new students or for reskilling. And it's brought like 3,500 jobs to these rural communities in about 7 or 8. And we need to do more of that. And John and I talked this morning about private-public collaboration in some of these areas. We need to continue to do that. One of the things I found really interesting in my role is I've talked to a lot of firms in cybersecurity. There are a lot of very seasoned professionals out there that really want to do mentoring and help grow the next generation. And to build those programs up, I think that's a real opportunity. It's real unique. And I think the last part is, like, my perception, having a lot of nieces and nephews who are college age, is that there's not an awareness that this is a whole industry, right? And they're put off by, oh my God, you've got to be so technical. I mean, it does require some, obviously, gaining technical skills, but a spirit of inquiry and good problem solving is really at, I think, the heart of a lot of what we need these cyber analysts and these cyber professionals for.
I was actually sharing with Laura earlier, my own wife used to be a med tech and worked in labs and hospitals, and now she's in the governance, risk, and compliance space. She's not super technical, right? But she is a very strong cybersecurity practitioner despite not having those technical skills. So it's important for folks to know you don't have to have been a network engineer for 20 years to go into cybersecurity.
In fact, there's many layers of cybersecurity. Myself, I'm the National Advisor for Cybersecurity and Risk. I don't have a deep technical background, but what my background is, having come from the FBI and run some national cyber programs, I look at the risk from a very strategic perspective. I understand who the bad guys are, and I know how to disrupt them, and I know what will work against them. And so really thinking about multi-layered recruitment approach for cybersecurity professions, and also attaching a mission to it. Again, from my government service days, helping folks know that, hey, it's not just sitting in a room coding all day. You're doing something that's very important and will help protect hospitals. Now, in fact, I'll just tell a quick little story here. I was doing a tabletop exercise for a hospital association, as I do quite often. And I come to a key point in the exercise, and I point to this individual, this gentleman, I say, so what do you think? And about this big decision that had to be made. He goes, oh, I don't know. I'm just the IT guy. And I said, you're not just the IT guy. You're a network defender. You help defend patients and communities by what you do. He looked up and he said, you know what? Then I would do this. We're going to pull the plug on the internet, and we're going to go to our emergency action plan. Helping folks understand how really important their role is.
Reframing the issue.
Exactly.
Yeah.
I'd actually like to add on to that. It's interesting. I manage a lot of technical specialists at Microsoft within security space, and we are focused on the healthcare and life sciences vertical. And they feel a calling and a mission being in that role, specifically working with these customers, right? It's very meaningful to them, and that's why they feel fulfillment. It's because of that mission. So, John, I think that's an excellent point.
I like how you said there's a multi-layered recruitment approach going on. It sounds like that's what we need to build awareness and get new people into this field. Okay, so let's switch to AI. We often, AI is everywhere. You hear it all the time. And knowing that cyber and AI are often symbiotic, both positively and negatively, should training programs provide blended curriculums then in these areas? Josh, let's start with you.
Absolutely. Here's the bottom line. The attackers are using AI, right? They're using it in their offensive measures. So we have to, as defenders, leverage AI as well. And so absolutely, it's integral to that skilling. Even I mentioned the technical folks I work with and manage even are retooling and skilling their credentialing and making that pivot. So it's here. Again, they have those tool sets. We have to use those tool sets. Imagine a professional football game, right, where a team doesn't step up to that next level of skill sets that's available to their competitors, right?
Or they only played offense, no defense.
Yes,
right?
exactly.
Yeah.
Exactly. So, yeah, absolutely. AI is part and parcel of any curriculum.
Yeah. Laura?
Yeah, I would agree. And really, when you think about it, you think about AI and what we need at the front line are prompt engineers, right? And what is that besides inquiry and problem solving, which I think are core skills and, are really are tuned to individuals with deep technical expertise or with broader interests. So I do think they're inextricably linked. And as educators, we should look to do that holistically.
It's funny you say that, Laura, because searching is a skill, right? We talk about Google and Bing as a verb, right? Being able to search and write a proper search term. And same thing with writing a prompt, right, for AI. You have to ask good questions to get good results.
Do you think folding AI into this will make it more appealing to future cybersecurity risk professionals?
Absolutely. Absolutely. I mean, look, AI
It's a little more sexy.
Yeah.
It's a little more
That's
sexy.
exactly
It's
what
a
I was
little more
gonna say,
fun.
yes.
Hey, okay, I can do this.
Right.
Yeah.
Absolutely.
For sure. So, Laura, is there something else we should be doing? We talked about some initiatives that are taking place, but what should we be doing more of?
Well, I do think it comes down to more partnerships. What we're doing, Microsoft is doing with the AHA and the White House to help secure rural hospitals, I think is a really good start. And we need more of that. We need more mentorship for seasoned professionals. We need more innovative programs. And what we really need, Bill and Josh and I have talked about this, is we've got this chicken and egg thing going where you can't get a job till you've got experience, and you can't get experience till you have a job. So we need to make some very practical and high value learning opportunities that are translatable and elevate professionals in this field.
No, totally agreed. So beyond the education piece, I think what's come out of the partnership that we have with Microsoft is really a shining example of how government, private sector interests, advocacy groups like ours can all come together to work on a problem, help solve a problem for the mutual benefit, not only for mutual benefit, but for the greater good, literally for the greater good. When I was having some discussion/debate with senior policymakers at the White House, and they said, you hospitals need to implement these cybersecurity standards. And we were talking about the same issues here, resources, funding. And literally, I happened to say to this individual, why don't we get Microsoft and other organizations to donate or provide nonprofit pricing the way they do for other industries to help refill that resource gap that you just told me the government can't fill. So instead of just looking at this from a policy issue, whole of government, as I used to say when I was in government, it's a whole of nation approach. Everyone has to come together, work on a common problem. We all depend on hospitals, no matter what, no matter where we live. And just in like my counterterrorism days, we've got to understand the threat. We've got to come together as a nation on this.
And I would be remiss if I didn't bring up the technological solution to all of this too, right? It doesn't solve everything. It's certainly a people problem. But we just talked about AI, right? Microsoft, of course, Copilot for security. We have almost imagine a really smart friend there on the side kind of guiding you through what to look for and how to solve problems. And we're seeing this from across the industry, but it's important. There's so much noise out there, right? There's so much signal, as we call it, coming in from different sources of security that it becomes a scale issue for humans to keep up. And so not just AI, but looking at a platform approach to security and how do we integrate all that. And I remember doing swivel chair between 50 different solutions, right? And trying to piecemeal, I think about, Laura and I think I mentioned in my role on the HOA board, right? My local HOA. We have cameras and card access and we have an incident. They're not integrated, right? So it's a manual process to go kind of link the two together. And we're just now moving to a vendor that automatically does that for us, right? So it's so important to have those pieces tied together and have that systemic approach.
Absolutely. Well, this has been a great discussion. I want to thank all three of you. Before we wrap up, I'd like to get some final thoughts from each of you. John, let's start with you. Anything else you want to add as we finish up talking about building a cyber-ready healthcare workforce?
Well, again, I think we have to understand how important cybersecurity roles are. Recent events, CrowdStrike, the issue that happened there, not related, not malicious, not a malicious attack, but it shows how dependent we are on the availability of technology. We have to understand that these attacks are increasing. We've had Change Healthcare that hit us earlier this year, all how dependent we are on the availability of technology. So these threats are not going away. The use of AI will accelerate these threats, quite frankly, but it'll also could accelerate our capability to defend against them. So there's a mission here. It's not just a field of work.
Yeah, dependent and vulnerable at the same time.
And vulnerable, exactly.
At the same time.
Exactly.
Laura, final thoughts.
Yeah, I think about this. I spend a lot of time working in rural hospitals and in the safety net, and I think they, as we've talked about, are particularly vulnerable. And, we're going to need to do more from a resourcing, from a funding standpoint to support them because, as we've talked about, it's not an if question. It's a when question for every healthcare organization. And so we need to look at those organizations as a vulnerable link in a very large ecosystem.
It's not an if, it's a when. That's a great way to put it. And Josh, final thoughts from you.
I just want to reemphasize that point about reskilling, existing folks, right? Just because I've seen so many examples of success of that. I did it myself, again, working in public education. I was in IT and then pivoted and brought that perspective and having been a classroom teacher, right? And then working at a school district in IT. So again, my sister is a nurse practitioner and we've had conversations. She's asked me questions before about, hey, that'd be interesting to pivot over to cybersecurity, right? So again, it's not just looking at those old school IT folks that somehow that is your only talent pool for these roles. I would really open up the field for that.
Absolutely. Look elsewhere, and you never know who's going to raise their hand.
Absolutely.
As you said earlier, we need people to start raising their hand. Laura, Josh, and John, thank you so much for joining us today at our podcast table at the 2024 AHA Leadership Summit. Once again, we have Laura Kriofsky, Josh Heisman, and John Ricci. Thank you again. To learn
Bill.
more. Yeah, John.
I'll be remiss if I don't
Yeah.
take a moment to just thank
Yeah.
Josh, Laura, and Microsoft for answering the call for assistance
Okay.
to help defend the nation's rural hospitals. We appreciate it as an association. We appreciate it as a nation. Thank you.
Thank you, John.
Agreed, and very well said. And for more information on this, please email mrhtp@microsoft.com. That's mrhtp@microsoft.com. Thanks for listening.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.